right. Hello, health heads. Welcome and thank you for checking in to this dose of the healthcare uprising. I am your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So, what's on our agenda for today, Heather?
Today we are chatting with Maria Haugen. She is the founder of FoXX Health, FoXX. FoXX Health is basically an app for women's health. And I'm not going to give you too many more details, but the cool thing about Maria is that she does not have a background in healthcare, much like many people that come on the show and are creating apps and bringing that sort of technology to us. And I want to read this actually from her LinkedIn page because I think it's great. It says, quote, "I'm not a doctor, nor have I spent my entire career in healthcare. What I am is a patient and a woman who has been continuously shut down, brushed off, and discouraged in my health journey. Who I am is my why. FoXX Health, by women, for women." So there you go.
Sounds like a perfect contender for this podcast.
Indeed.
All right, then. Well, without further ado, let's get into it. Here's our conversation with Maria Haugen from FoXX Health.
Hi, and welcome to the Healthcare Uprising podcast. Today we have Maria Haugen with FoXX Health with us on the show today. Welcome to the Uprising, Maria.
Thank you. I'm very excited to be here to be speaking to you both.
Yeah, me too. I'm super excited that you're on. I was actually telling Jeremy before when he walked in, he was setting up, and I said, I'm really excited about this one.
She was more than normally excited today.
I am.
Oh,
Well,
that's
yeah,
so great. I'm really
because
happy to hear that.
yeah, FoXX Health is doing something that I am 100% invested in and can be a part of. So with that, tell us a little bit about your professional, personal background, anything you really want to share, and essentially what has led you to bringing FoXX Health to all of the healthcare universe.
Absolutely. My background professionally is not linear. I started in advertising, then I went back to school and got my MBA in supply chain. Then I went into consulting and spent a lot of time in consulting, where, if you know what consulting is, it's basically working in dog years. You are working so fast on so many different projects, so many different verticals that you really have to become a jack of all trades. And after that, I switched into slower companies, smaller companies, really to hone in on my skills. And I realized that my skills really meant nothing without them being tagged to a mission. And I didn't have that in my life because I had worked across so many different verticals. I didn't really understand where I fit in. And what led me to FoXX was my own personal experience with my health scare. I'm a relatively healthy person. And when I was in my late 20s, I was laying on the couch, I was watching TV, and all of a sudden I had a little pain in my jaw. And then it started going down the side of my neck. And then my chest kind of started cramping and my arms started hurting. And I was like, what is happening? And it took me a minute to be like, these are all of the signs of a heart attack.
That's what I'm
And
thinking.
yes. And so, my parents were home and went to the emergency room, and they can tell, if you're having a heart attack or had one, do an EKG. I didn't, and I wasn't. It was not a heart attack.
Huh.
And so, wasn't emergent. They said, schedule a follow-up with your primary care, go home, rest. And that was the thing. I was resting when it happened already. So I said,
Mm.
okay, I'm gonna go home, I'm gonna relax. I go into my PCP and they're like, well, it's not your heart, so I'm not going to send you to a cardiologist, but I don't know what it is. So we're going to have to keep kind of tracking when it's happening, call me if anything's triggering it, and let's just keep you under observation. Well, the problem with that is the episodes kept happening. There was no consistent reason they were coming on. And when they happened, they then would leave. So there was no way I could be sitting in a doctor's office when it's happening unless I
Ugh,
were to
that's
stay
the
there.
worst, right? It
Exactly.
never happens when you're in front of the doctor.
Exactly. And so it was, then when I kept saying it was happening, they're like, well, you're probably just stressed. And how are your hormone levels? And what is happening in your life? And I'm like, the only thing stressing me out is you and the situation. Like,
Oh my
I
gosh.
think I'm gonna die, so I'm a little stressed. And finally,
Yeah.
I started cold calling cardiologists. I was like, someone needs to take me in, someone needs to tell me what's going on. And finally, I found one that would take me without a referral, but they're already backed
Mm.
up. So it was 2 months before I got in, and I was diagnosed on my first appointment with costochondritis, which is in most cases solvable
Whoa.
through taking medication. And I did that, and I have not had a flare up or episode since. So why did I go through 6 months of feeling like I'm having a heart attack, like I'm going to die, looking at mortality in the face as like a healthy 26-year-old woman? And I just thought, there has got to be a better way. There has got to be. And there wasn't. So I started FoXX. And when I say started it, I mean I started writing things down and interviewing people in a casual way. But I spent 2 years talking to, people in my circle, people outside of my circle, expanding who I'm speaking to, including doctors, and found the error. And the error is presenting our symptoms in a way where doctors can be actionable about them. Right now, the system is all about reschedule, record, and revisit. You come in and you have to reschedule an appointment because they tell you to go home and record what's happening so they have a more accurate depiction, and then you have to come back and revisit with them. So we're taking time, we're taking energy, we're not taking advantage of the short amount of time doctors have with us. So FoXX is really aiming to bridge that gap and more.
Yeah. This is this is a common thread on the show is what companies like yours, apps like yours are doing. Um, it,
People
it
have to be their own doctor now.
you really do. You've got to record and because otherwise you're just being sent from one visit to the next. Months and months are going by, um, and you still don't have answers. And in the meantime, it's getting worse. You're terrified, right? Am I
Hmm.
am I going to die? Like, is this going to kill me? You have no idea what it is. That's not a
Right.
good place to be. So,
Exactly.
That
And
was a
women
gr-
have, oh,
that
go
was a
ahead.
great setup, but can we now hear what you actually specifically do?
At FoXX?
Yeah,
yep,
Yeah, absolutely.
because that was
So,
a great setup. Now I'm very
yeah,
curious as to exactly how you're applying all this.
yeah,
yes, absolutely. So, FoXX Health is a mobile app, and what we aim to be is the new home for women's health. What that means is you are able to track your entire body's symptoms on a regular basis. You're able to, over time, of course, with tracking, see the correlation between your symptoms. You are able also to run those symptoms through our AI, which I know is, please don't stop listening. I know AI right now is a buzzword, but we
it's
are
all
not.
over the place.
Exactly. We're not just a chat GPT with our own UX over it. We have trained our own AI with the United States National Library of Medicine. We received a license through them, which you have to apply for, which a lot of large healthcare organizations have. It's rare that a startup gets it. SNOMED International and the NIH for women's health data. We've trained our AI to not only take your symptoms, but your age, height, weight, socioeconomic status, your race, and any medications you're taking. And what we do is we run it through our AI and tell you what you need to speak to your doctor about. We are not diagnosing you, we're making you more prepared. And in turn, the doctor will have a better and more clear way to help you get to a correct diagnosis and get to that diagnosis quicker. You can take notes during that appointment, do talk to text, and really have all of your health in one place for your whole body. In addition to that, there's a community feature called the Community Den. It follows the Reddit model. Each of our dens act as a subreddit for different types of women's health, reproductive health, cancer health, any type of health that you want to speak about. You can go and speak to other women anonymously to learn from their stories. And hey, has anyone taken this medication? Or I'm up in the middle of the night, or hey, I'm noticing on my graph my headaches are correlated with my cycle. What does that mean? So it's really about women are more than our uterus. Women's health should be more than reproductive. We're not just men who can give birth. So our health should also look at us like that.
Yeah. So it
Yeah.
does a lot. I love the den feature too. That's just pretty cool because
Mhm.
women are just naturally we want community. We crave that kind of connection with other with other women or other people or whatever that community is, right? Like we're just
Right.
always, I feel like we're just always looking for that, right? So
Yeah, absolutely.
yeah. And I guess even better, you can do it anonymously. Um,
Yeah.
I will say so I get like Reddit's kind of the for younger, we'll say younger generations. Like I'm definitely not like an avid user of Reddit, but I keep hearing more and more about it that like a lot of conversations happen out there.
Mhm.
But
Oh, it's you
that's
can find anything on Reddit.
right. Like I mean, when I like Google search, like I'll end up in like a Reddit thread at some point. I've
Yep.
gotten some good advice from a Reddit thread, to be honest with
Oh, it can
you.
be super helpful if you know how to search it right. Yeah.
Yeah, yeah, but the idea of having, I don't know, like putting that kind of like more like health related stuff out in a more public forum like that makes me feel a little uneasy. So that's why I particularly like the this idea of the den. So,
Hmm.
Absolutely. I believe last year that Reddit was the number one growing app for the mention of women's health and
oh
how women's
wow.
health was being spoken about. It is very easy to search, and speaking anonymously kind of gives you that you're more honest when you're anonymous. And so you're
Hmm.
able to help other people. And women started turning to that more than their actual doctors, more than WebMD, and close behind was TikTok. So we're really trying to not only help women get the answers, but battle misinformation. And we're hoping that the younger generation will also adopt this, safe space in a
Hmm.
trusted environment to talk about their health.
Yeah. Yeah, well, as time goes on and technology plays such a huge role, that's a big focus of our show, bringing folks not Fox but folks like you onto the show is we're putting healthcare into the consumer's hands, right, into individuals' hands, and that kind of advocacy, right? That personal advocacy, the tracking, like walking into a doctor's office with all of this information that you've been tracking, like that's where it's at. It's a
Mhm.
huge shift. Yeah, we talk about it all the time on the show, just from the nature of the people that come on, and it's pretty exciting, quite honestly, because I think Jeremy, the way I described it, like way back when we were starting this podcast, I'm like, remember when everyone cut the cord from DirecTV? And then they decided, well, I want Netflix and maybe I want Paramount and maybe I want Hulu, but I don't want ESPN and I don't want Prime, and you kind of decide, you can decide what you want when you need it, depending on what season of your life or your family's life is in. And it's giving us a lot more control because it used to be so, it's like kind of, well, you have insurance and that's what you get.
Yes,
So,
exactly. And one of our features we're adding to by the end of this year that is kind of just like I want this, not that. And my family uses Netflix, but mine uses Disney Plus. We're going to incorporate wearables, so you'll be able to upload your
oh,
wearable information as well and run it through our AI. Because if you already have that data, you also want that to be included in your health journey. So how can we make it really customizable? Because no health journey is the same. Like not one to one, not 1 to 100. Every single person is different. So we have to make it as customizable as possible, especially in health.
yeah, for
Yeah.
sure. And with women's health, right? Because we're just
Right.
complicated.
So complicated and under researched. Like you think would be more
Yeah.
fun to research at this point because we need to figure it out. So yeah, definitely in women's health.
Yeah.
And it's nice that we have the emerging technologies that are, allowing people like you to do these things.
Exactly. Yep.
Because without the AI, compiling and tracking all that data would be just such a mountain to climb. The
Hmm.
AI can do it like nothing. Like
Hmm.
just get right
Right.
through it. But that's
Absolutely.
the real helpful part there.
Yeah, and that's why with AI, it's so much more than just a chatbot that you can, train to have parameters. Like, how are we actually using AI? And it's exactly that. It was meant to supplement the enormous amounts of information we have out there, and then how are we utilizing the output? So we wanted to make sure that if we were going to include AI, it was going to be in innovative to some people, but really in not just a linear way. How are we actually using it to our benefit to differentiate us and what we're doing?
Yeah.
Yeah.
That's awesome. So, yeah, so let's dig in a little bit on kind of the deets, right?
Yeah.
of FoXX Health. So, obviously, we've touched a little bit on the dens. You've kind of highlighted a couple of things, high level, but like I want to understand what it feels like to use it. And by the way, for the record, I signed up for, I'm on the wait list because it
Yes.
hasn't
So,
been launched yet because it's
right.
coming very soon. So you'll have to share a little bit about that, kind of the timeline of when it's coming, but also like what will the experience be like for somebody like me? Like, how does it work really? Like, so let's talk about that a little bit.
Absolutely. Well, earlier today, I actually received the link and I have Fox on my phone. We're in the final testing stages, so you will be getting it soon. Thank you for joining
So
the wait.
exciting. Yeah.
Yes. So I was playing around with it, but basically the journey is how you want to take it, and our goal is that compilation of data. So when you open up your Fox screen, of course you go through an onboarding as a new user, but say you're opening it on a regular basis. First and foremost, we always prompt, do you have any symptoms to log today? And we have an option that says, yes, I want to log it, which will take you to that screen. But we also, just as importantly, have nope, no symptoms today because it's important to log the good days, the regular days as well. That's data that can be used to show all of your health journey. From there, you can look at any upcoming appointments you have that, of course, you would put in, any checklists that are ready to go, or any past ones that you want to review notes from. You can head on over to the den, talk to people, look at the popular threads that are happening, go into a den, ask a question, and then also you can use the AI. If you're curious or you just schedule an appointment, you can go through the steps to run your information through the AI and receive those questions. So it really depends on what you're logging in for, but on a regular basis, that symptom tracking for any symptoms or even no symptoms will get you more accurate data to look at the correlation and what your health history looks like. And then the community den, both things you can use on a regular basis. And then everything is meant to be, appointment centered and how you're really able to advocate for yourself, understand what you're speaking about with the doctor, and just feel more in control of your health overall.
Yeah,
Cool.
there you go.
So you're tracking, you're hopefully then you're armed with information as you go in, um, and much more knowledgeable. Talk about what's been occurring maybe since the last time you had a visit or in between the visits or maybe new stuff, right?
Mhm.
And then hopefully is the intent then that if you're, well, we know obvious, much more efficient use of the limited amount of time that you have with that doctor, which by the way, going through a situation with my husband right now, realizing sitting with the orthopedic surgeon doctor, the other day, I realized, oh my God, I have a billion questions. And then so I wrote them all down just like in notes in my phone. But there was a lot of other stuff that was going on that I hadn't recorded or that he hadn't recorded. And I thought, gosh, this would have been really helpful if we had been doing this. And then even more so, sitting in the appointment and the doctor's telling us a bazillion things. And I'm like trying to quickly write everything down in like a notes, in my phone and realizing I don't even think I got all that right. And he just like threw just a crap ton of information at me. I'm
Mhm.
like, oh, I feel like something like this in terms of like women's, right? Women's health, that's the place to do it, right? And so then it's all right there. You walk into the office, you feel a lot more, I don't know, ready, maybe just prepared.
Confident. Yeah,
Yep,
like why you're
absolutely.
there.
Yeah,
Helps a
Right.
lot when
And
you know why you're there.
right.
exactly. And especially in a stressful situation. I mean, I talked to a couple nurses who said that their experience was they went in and they're a nurse and they leave and they're like, crap, I forgot to ask that question.
We all do
And
it.
yes,
Yeah.
exactly. So even your situation specifically in Fox, each of the questions, say, okay, my questions are in Fox. You can take notes under every single one
Mm.
and talk to text. So that way you can just record and it will do talk to text. So you're not recording someone's voice, you're recording their words and it will write it out for you. So you can go back, down the line, of course, after launch, we're going to incorporate a summary feature. So then the AI can compile all your notes and say, here were next steps that came from it. Here are key outtakes. We're talking to scribe partners in order to help us do that more efficiently from the doctor side. And then finally, for women specifically, it doesn't fall on us that sometimes women are taking care of their older mothers or women have daughters away at college. One of the key sentiments from user interviews was that even if you're in a high stress environment, we talk to cancer patients, they bring a friend because it doesn't all compute right
Mm-hmm.
away. So there's a shareable function within FoXX where another FoXX user you can share your checklist with and they can help take notes or they can help fill those gaps in for anything that you need. Or as, mother, daughter, friend, caretaker, you can also still be involved in that health journey for someone you might not necessarily be sitting next to at the time.
Mm. I love that. That's
There you go.
brilliant. Gosh, and one thing I can tell you, we all need somebody like
Yeah.
looking out for us when you're in that kind of situation. So I
Right.
have been learning that over the last few weeks with my husband. And I'm like, my God, if he didn't have me, he'd be so screwed. And
Right.
even I'm overwhelmed. I'm like, wait a second, I'm the one who knows everything. And now I'm like, I don't know everything anymore. It's just gone right out the window. So,
Exactly. And now you need a support system too. So, that's
right.
say Fox is your own personal advocate in your
Yeah.
pocket. So,
Yeah. Take care of the caretakers. So
right.
There you go.
Exactly.
I've been, yeah, I'm screaming that one from the mountaintops.
Yeah.
But
I'm
Fox
sure.
is specifically for women's health, though, right? Like
Correct. Yeah.
it wouldn't really work for Jake specifically.
No, no, no. It wouldn't. It wouldn't. Unfortunately, no. We need a. I don't know what's going to answer. I don't. We're not sure what's going to help Jake.
Yeah. Aw.
We've been trying to figure that out for
Yes,
years.
we have. Sorry, honey.
I had to do it.
Me too. Me too. So are there, do you think, and now I know you haven't launched the app yet. It's coming. It's like right around the corner. But you've been doing these interviews, you've been using that information to build out what FoXX Health looks like today based on all of that input. Do you feel like, or is there anything kind of telling you in the data of all of these conversations of like certain, I don't know, types of conditions or things of that nature that might be like well served by something like this? Things stand out to me like an endometriosis. I still can't say that damn word.
Endometriosis.
Endo. I'm just gonna call it endo. Or you know what I mean? Like really complicated, hard to diagnose types of conditions like that.
So that is not what the data pointed us to. It wasn't women with chronic conditions. It was actually women who left appointments frustrated because they weren't heard. It wasn't specific to a condition. Endometriosis is definitely one of those where because it just has been coming around with research and everything within the past 10 to 15 years, that it's harder to advocate for yourself because there are so many different ways that symptoms occur and it can manifest. And to be clear, endometriosis, especially in later stages, can spread to other parts of your body. There have been documented cases of endometriosis being in the brain, being in the stomach. So
Hmm.
that's a big reason why it's important to look at your entire body, not just one part. So a lot of our user surveys, our user interviews actually were feature focused about what would you like to see? And symptom tracking was number one, which is a big reason why we've really built it out, really thought of every way that someone could use it to really enhance that journey. And to your question, any specific condition, I think the biggest condition that women face is not being heard.
Mm,
Yeah.
that is a condition in itself.
We have episode
Right.
19. We talked to the woman from New Zealand about endometriosis, and she went through that herself. It took her 10 years to get an actual diagnosis.
Yeah.
And she ended up putting herself into remission because they couldn't do it for her.
Hmm.
But
Wow.
yeah, that's episode 19 if you want to hear all about endometriosis. She
There you
got
go.
it figured out.
And she created an app to support people with endo.
Yeah.
So yeah, I love it. Like that's where like the best ideas come from experiences like yours, where your situation too, by the way, that the what you were ultimately diagnosed with is is that like a high prevalence in females, or is it just could anyone have this?
Yep. So anyone could have it. And actually, I was speaking to another woman who, when I was explaining my journey to her and I said costochondritis, she like jumped and she was like, "What? I got diagnosed with that too, and no one's ever heard of it and knows what it is." And everything because a lot of times the symptoms don't get as severe as mine. So people think that tightening is just anxiety, especially in women. And people are like,
Hmm.
"Oh, I'm having a panic attack." And you're like, that is a diagnosable condition. And that is really, what we're trying to improve is is it all in your head, or is it something that you can actually help correct, whether that be through a lifestyle change or through medication? We want to be a really healthy mix of holistic and Western medicine because it's so important when we say take back control of your health, that isn't as linear as eat right, exercise, sleep. It's not like that in most cases. So a lot of being healthier is understanding your body, your health, and taking that control.
Yeah. Not everybody needs the same things.
Hmm.
Exactly.
So that, yeah, that we know. We we've learned that here on this show quite a bit. As you were talking about having a strange condition, right? Like one that no one's ever heard of. Jeremy, I'm thinking about Sabrina, who just came on, um,
Uh,
with a very strange autoimmune
oh, I got it.
condition.
Ankylosing spondylitis.
These words are
Oof,
crazy, right?
that
Like,
took me a second to bring that
yeah,
one back.
Wow. See,
good
and
job.
that is so
Ankylosing
interesting.
spondylitis.
That could be a trivia question, like which one of these is not a real medical
Oh my
diagnosis, and put it
Ooh,
on there. Like, you know what I mean? It sound that is not even a word I've ever heard of. And I've
right.
been building FoXX for close to a year, legally, and then 2 years of discovery interviews before that, and I've never heard that. And that's
Mhm.
what happens is you have to, DIY healthcare, do it yourself, and
Yeah.
figure out what's wrong with you.
yeah.
Yep.
A lot of our episodes are about that.
Oh
Yep.
yeah.
That's where everything's going.
Yep.
Yeah, that's
It's
it.
like you got to figure out, it's WebMD has gone to the next level where you now have to figure out your own problems and then go to the doctor and say, Doctor, here's my problem, fix it.
Right.
Because if you go to the doctor and ask them what your problem is, we just went through, it's going to take months and
Right.
multiple appointments over months of time, and they still might not figure it out.
Hmm.
Right. And the younger generation is turning to TikTok, which they go to influencers that they relate to and they can
Hmm.
trust. But in reality, there might be some very clear indicators and biomarkers that make their journey so different, but they're the ones who are influencing what these younger women are eating and what medications they're taking over the counter, and low inflammation diet, keto diet, Mediterranean diet. I mean, there's such a fad of influence, but where is the credibility portion of it? And that's a dangerous game.
Mm,
Yeah.
that's a good point because there's a lot of people out there doing that, right? And which is great. I mean, there's positive to it, but to your point, it
Absolutely.
could be, yeah, it could potentially be to somebody's detriment
Right.
by not getting uh, clin clinical advice and guidance still has its place in the world for
Right.
Still
sure.
need a doctor.
Yes.
It's
Right.
So,
And
it,
that's a big reason why with FoXX, we
mhm,
never, I truly believe at my core, doctors became doctors to help people. I think that there is such a small, small percentage of any doctor that willingly wants to keep someone in pain and undiagnosed.
mhm,
That being said, there are some severe flaws in the system that cause the months of wait time, the misdiagnosis, that is something we're working with, but with influencers being in the healthcare system, the danger there is people just want someone to listen. And when you hear someone else is going through something similar, you want
mhm,
to listen to them because now they're your North Star. You're like, I'm not alone. And that's really what we want to use the community den for, de-influencing, but still giving people and women an outlet to find another woman who has gone through something similar or can support them.
yeah. Yeah, we another thing we talk a lot about here on the uprising is the system is not built to let doctors doctor, which is what they want to do, right? Like that's what they want to do. Like to your point, they didn't go to all this schooling to
Mm,
get that MD at the end of their name to push paperwork around and
right,
push their patients off for months and months and months. They're not doing that on purpose. They don't want that.
right,
Um,
exactly.
but but now with like FoXX Health, with all these other apps, with all this other technology, we're and putting the power back into put it not back, it was never there in the first place. For the first time, putting the power of our own health into our hands through the
Right.
support of technology. Like that, I think that's gonna shift things, right?
And it's such a weird, bittersweet sort of thing because it's nice that we can have that power, but it's sad that we have to use it.
Hmm.
Right.
You know what I
Right.
mean? Like we could
And never
have a
leave it there.
system that could just help us and we wouldn't have to do all that ourselves. But
Exactly. Well, and even the shift of healthcare, we've seen a lot of concierge models popping up, especially for family practice type of medicine providers, where you actually pay a membership fee. And you can say, okay, for $1,000 a month, I'm securing mine and my family's spot. So that way the doctors can cap the amount of patients they take to
Hmm.
combat that exactly. I mean, a doctor should be sitting with you, should know you personally to really help with that health journey because every person is an individual and they cannot do that. And that
Hmm.
really exposes the flaws in the system, the paper pushing, the, lack of even profession. People nowadays want that quick fix. And medical school is not a quick fix to making
Hmm.
a lot of money. And everything that people glorify nowadays has to do with instant gratification. So there's an epidemic of a lack of doctors, lack of nurses, lack of people who are in the system in general, and it's already overworked. So doctors are trying to crawl out from under it with this concierge model. People like myself are trying to crawl out from under it by giving us the tools to advocate for ourselves better. And eventually, it's going to have to change on a very fundamental level.
Yeah. Yeah, I've seen a couple of family practices just here in Flagstaff. I think there's two now that use that concierge level. It's basically cash pay is kind of the
Right.
easiest way of putting it. You're not using insurance. You're
Right.
you're I mean you can, but they're moving away from that.
Mhm.
Um so yeah, whereas, insurance used to be the one and only thing. Um to me, insurance is becoming more of a background thing.
Yep.
it's
Um
because less and less people can afford it and
Well, and
less
also
people
that.
have it.
Yeah. So,
Well,
and
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 it's
yeah.
so decentralized. Like you need your insurance, and then people talk all the time that your teeth and your eyes are separate from your body, and
Yeah,
that's not
that
included in
mm,
your insurance. And I mean, people are starting to expose these flaws, like how
Yep.
is this happening? So yeah, absolutely. A lot of people are moving to the cash model, and there are a lot of smaller, more personal insurance companies popping up, especially if you have unique needs.
Hmm.
Chronic conditions need different types of insurance. I have contacts, I have terrible eyes. And so I focus on my vision insurance, and that's important to me because I use it fully.
Hmm.
And that's just not something that you normally get in just your standard package, and people are moving away from that.
Yeah, for sure. And so it's like these kind of like niching out, right? Like across the industry. And obviously women's health is huge, right? I think we're finally getting like our heyday, right? Like our
Yeah.
platform. It's finally here. I mean, you're working in this space. Fox Health is for women. And also I want to, we're going to find out what the origins and the meaning of Fox Health are before we hang up with you today. But why now? Why do you think this is happening, particularly with women's health? Because I feel like sometimes I feel like I'm in my own echo chamber.
Mhm.
But I think it is huge. There's a huge shift in women's health and how we're supporting it and talking about it.
Yeah, it's social. I think
Mhm.
that it's been brushed under the rug for a long time because it could be. And there were only a few people talking about it and, trying to put it on the forefront of people's conversations, and there were just more pressing matters. But it's having its heyday because it's now a social issue. And, not, without going too far in depth, I think everyone knows what I mean when I say that. I think
Mhm.
that any PR is good PR. So if people want to talk about women's health in any capacity and that's the center of the conversation, then let's use it. Let's ride that wave. Let's put these, facts down on the table and say you cannot ignore it anymore because it's already a big topic. So get on board or face the consequences, really. I mean, there are people popping up talking about institutions that have never supported women's health, or they have a women-owned business for healthcare that's really just a woman who doesn't do much and they're just operating under that person's name. Hospital systems are forcing to put women-focused healthcare in their, mission and their vision and put wings in. And I think that it's fantastic. And I think that the time for Fox is now because while so many established institutions can put women's health at the forefront, that doesn't mean that it's solving the issues. It just means we're at the beginning of talking about it. What we like to say at Fox is we can't change the system overnight, but we can change how prepared we are to survive it. And that's what Fox is trying to do.
I love it. I'm here for it. Um, yeah, we see it too, right? Like we see the opportunity
Yeah.
through the show, through all the people that we meet. I have been in the healthcare industry for 23 years. So I've seen a change.
Yeah.
And I've been everywhere. Like I've been everywhere. And I tell everybody this is the absolute most exciting time to be in healthcare. Like this is the industry you want to be in right now.
Right.
There's just so much change. And like it's all on us to change it. And especially with companies like yours, when you think about like these insurance companies and these health systems, it's like turning the Titanic. It is
Right.
hard to change things because you've got bureaucracy and it's just big, you know? Whereas like you're nimble and you're inventive and you can decide something one day that you're not going to do anymore and be like, nope, we're switching gears just
Mhm.
to react to to whatever you're hearing out there, right?
Right. And that's what I was going to say too, is healthcare has always been too big to fail,
Hmm.
too big to move, and stuck in the canal per se. And there was really no way around it because you can't collapse a system that is keeping a lot of people alive too.
Yeah.
Hospitals can't just shut down. But what can you do then? You have to, one of the biggest pieces of advice I was given early on is healthcare matters for the patient and the doctor. And to be truly successful in changing the system, you need buy-in from both. Whether it's a pharmaceutical, a med device, or an innovation, it has to be adopted by both sides. How are you truly influencing the journey for both? And that's where you're really going to find the fundamental success in this industry.
Yeah. Truer words have never been spoken. Yeah, I'm with you on that. And I think we hear that sentiment on the show too a lot, Jeremy, with like everybody that comes on. So, which is great because it's not always been that way.
It's not just a movement, it's an uprising.
Hey, way to plug
Exactly.
ourselves.
Ah,
Yes.
So
shameless self promotion.
there you go.
It's my specialty.
So before, as we try to like wind down our conversation here a little bit, one, I want you to tell us what FoXX Health, the origins of the name, the background of the name, um, and then we'll wrap up with a couple more questions. But first, the history, the meaning.
So when I first started Fox, when I first had the idea, it was just called Company XX. I have the original deck I made when I was just putting ideas onto slides to try and understand, like, okay, there's an issue, but what is it? What is the actual issue? That's where I would put my interview notes. That's what I was doing. With a background in marketing, I was like, I can't just call myself double X, Elon Musk would come for me at that point. But I was like,
Yeah.
all right, what about Fox? And it stood for females only, represented by the two X chromosomes that make us women. And in our branding, the F is capitalized, the O is lowercase, and then the two X's are capital. So, kind of showing that it stands for something without having to say it every time.
Mhm.
And now Fox stands for four only double X chromosomes that is meant to be indicative of the information we're using to train our AI. And we made that change because we wanted to be mindful of the changing social landscape. What it means to be a woman is not up to me to decide. We want people to be safe in their health, so we want to be very transparent about the information we're using. I welcome anyone to use our app, and I want them to know that the data is focused on people with 2X chromosomes as indicated in the licensing data we're using, how we're utilizing our AI. But that does not mean our community den isn't open. It doesn't mean you can't track your symptoms, but it's really about how we're being inclusive without being dangerous in utilizing a medical product.
Got it.
Sure, sure.
Cool. And I believe when we chatted before we did the recording, you said that you worked with doctors to really build this app out. And so there's a lot of that, there's that clinical input in the actual development of the app itself.
Yes, so we have an advisory committee of 130 women who beta tested our app, and 30 of them are either RNs, NPs, MDs, OBs. So they had influence over the language because if you walk into a doctor's office, we don't want them to say, please put that app away. We want them to say, hey, do you have FoXX? That would be really helpful for your next appointment. So for symptom tracking, it's not just oh my elbow hurts. It's okay, how long did it hurt? Was the pain throbbing, stabbing, pins and needles? What was the severity of it? And was anything else happening at this time? So that way, when you go in and you are explaining to them, they're going to ask you the same questions. So if you're coming in prepared, but also saying, whenever my elbow hurt, I also had a headache, they're going to say, oh, interesting. That kind of changes what I'm thinking, but gives me more information. So ultimately, we're trying to also help the doctor conversation. What information can we give them to truly reduce the misdiagnosis and reduce the time to diagnosis?
Yeah, that's really cool. It was interesting, just because, like, going back to what we were saying earlier, doctors want a doctor, right? Like,
Mm,
one of the most interesting things, and again, having like been in kind of an acute situation with my husband, what I found the most fascinating is when the doctor, you can tell he or she is sitting there for us, it's been a he, um, really wanting to understand what's
mm,
going on with my husband, with him as a patient. He's like, I've been thinking about this. Like, he doesn't clock out and go home and, not think about his patients. Like that's he's like noodling this stuff in his brain and he's thinking about it. And he was like, yeah, I really want to think about like the best way to do this. And that's not the first time I've heard a doctor say that, right? And so it's like they really do care. They really
right.
do care. And if FoXX Health can show up to help them do their job better,
Mhm.
like bring it on, right? Like who would say no to that?
Right, exactly. And it's all about, helping the system at its core level. And I think a big part of that is enhancing the conversation, having that accountability to show up ready to give your doctor all that information. And I think it will be a more productive conversation and health journey overall.
Yeah, definitely.
Mhm.
So with that, what's next? So we've got the app that's going to be launching. So do you have a date for that
I
or?
was actually curious about the wearable too, if you're going to
Oh
tie
yeah.
into existing wearables or have your own, things like
Yep,
that.
tie into existing wearables. So what we're able to do is we're exploring a partnership with a company that has over 300 wearable APIs. And what we would do is actually just buy the API on a monthly basis. So if you had an Aura Ring, an Apple Watch, a Whoop, you would be able then to have your dashboard within FoXX and then run that data through the AI.
Oh.
So it's existing
There you
wearables. We
go.
don't want to make a wearable. It's why not meet the people where they're at instead of
Mm-hmm.
trying to compete with it.
Heather's like, I have an Aura ring.
Aura and can you see it?
Oh yeah, nice.
I
Okay.
have two. I use them for different, weirdly, I use them for different reasons, but
Well, now
whatever.
you can
You are
tie them all
not the
into the
only
same app.
person. Yes,
Right?
no, when someone says they use wearables, that means on average two or more.
Two, yeah. Yeah, I'm all about it. I'm like, track everything. Tell me how terrible I'm sleeping, how crappy I'm eating, my
Mhm.
heart rate's too,
I
all the
don't
Right.
even
things.
wear shoes, never mind wearables.
He
Yeah.
has no idea what's happening
Oh
with
my
his
God.
body.
I feel
Amazing.
good, man. I feel good. That's all I know.
Hey, sometimes that can be bliss too, right?
True.
That's sometimes just not knowing.
So when does the app launch?
September 29th.
Okay,
Oh,
Yeah.
wow, soon.
soon,
Yes.
soon.
So we are going to put it in the hands of our committee members first because they're the ones who tested it, everything, and then it will be available to the public on the 30th. So we are
Awesome.
We
giving them
might have to
Well,
push up the release date for this
Yeah, yeah. I was saying, I think the episode might drop really close to the
because the
launch date.
30th is a drop day.
Oh, well, maybe we can
So
help you
I'm
out there a
thinking
little bit.
maybe this episode's going to come out on September 30th.
Yeah.
oh,
We,
okay.
yeah, we control that schedule.
We
So
have that
Yeah.
power here.
yeah, we
Oh
do. The
my
one little power that we have in the world right here
Yeah.
God.
in
Yeah.
our show. Cool. So
Amazing.
the app launches on the 30th. Okay. And then is there anything else that's kind of coming down the pipeline after that that you can talk about, or is there just kind of a lot
Yeah.
happening that could
Absolutely.
happen?
So, I mean, one of the initial things we're going to do is be able to send push notifications or put a widget on your phone. So that way
Mhm.
you can see it and be like, no symptoms, or I want to log something. So that way it's really easy. We didn't want to what is the word? Inconvenience someone's day. We want
Mhm.
FoXX to be a part of it. And then the wearables will be before the end of this year. Our goal is to
Okay.
have it by the holidays because wearables are a huge gift, especially anticipated for this
Oh,
year, because
yeah.
health is such, again, a social movement right now. So people
Hmm.
are already purchasing Whoops, Aura Rings, Apple Watches because people want that data. So we want to be a part of that. It's like, pair your Aura Ring with FoXX and
Hmm.
let's get you back on track with your health. So by the end of the year, because we want to ride that wave.
Nice.
And the app itself, so it's individual focus, so it's not going through like health plans at this point, nothing like that. So it just as an individual, I can sign up for it. Will there
Yep.
be like subscription plans? Like how will that work?
Yes, so subscription model for the first month. So if you are able to, move the schedule around, the first month it will be $2 a month.
Okay.
Representative of those 2X chromosomes, getting our first users, our early believers on it, it will
Hmm.
jump up to $5 the second month. And then once we incorporate wearables, we will introduce tiered pricing because we
Okay.
want to be, aware that not everyone does have that and not everyone will utilize it the same way and pricing will change from there. So I recommend getting on it quick, but it will be a subscription type of model.
Yeah. Lock it in. And
Yes.
will
Reasonable price though, $5 a month.
yeah, that's not bad at all. And
Mhm.
will the subscription cost be like HSA or FSA eligible as well? I know you see
Um,
that
we are
sometime.
we are working on that right now. So
Okay.
we are not only talking about that, but we are also talking to larger benefits companies
Hmm.
to have it available for employees and covered
Oh,
under different plans. Because I think again with that push for women's health, companies have to
yeah.
be on top of it. How are they also investing into women's
Yeah.
health? It's getting women the tools they can actually use.
Gotcha. So you could show up through kind of the employee benefits channel, which that makes total sense, by the way, because I worked in that space for a while. And if it was me, I'd be like, you need to get them.
Right. Yes,
So
exactly. Yes, that is one of our goals too. My
nice.
never-ending list for the end of this year is pretty exciting.
Yeah. Yeah. All the like kind of supplemental benefits that an employee can choose, particularly in industries that have a lot of women, like
Right.
healthcare, for example,
Exactly.
very high, retail,
Yep.
stuff like that. Yeah. Well, awesome. Well, this is it's super exciting. How does somebody find you online or get started or get on the wait list like I did?
Yes, they can go to our website, foxhealth.com, and join our wait list. I highly recommend interacting with our socials. We're not only going to do a lot of myth busting for different types of health myths, especially in women's health, but we are also going to be walking you through how to use different features to the best of, what they were built for, especially during our launch. And then, as always, I would welcome anyone who wants to talk to me personally. The best way to get a hold of me is through LinkedIn, and I'm very active on there. And I'm always talking to users, always open to suggestions because with this app, I've spoken to so many women. We have that advisory committee. It was truly built from women's voices, and that doesn't stop when we launch.
Awesome. Well, I love it. I'm here for it. Can't wait to sign up and start using it myself. So, um, Maria, thank you so much for coming on the show. Excited to see where Fox Health goes um, this year and in the coming years. So, lots of big things coming, I'm
Yeah.
sure.
Thank you both so much for having me. It was great talking about Fox, and I will see you on the app in the den.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube and Patreon, patreon.com/healthcareuprising, if you want to watch us in action.
You can also find us on social media on LinkedIn, Blue Sky, Instagram, and Facebook. Just search Healthcare Uprising to find us. And if you're a new company or creator with a cool new product for the healthcare space, or if you're someone with a personal healthcare journey and you'd like to share it with us here at the Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. That's all for this dose of Healthcare Uprising. Till the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
This has been a Shut Up production.
Shut up!